Hi, my name is Dr. Bruce Crawford. I am a periodontist with over 25 years of experience helping patients throughout Florida live a better life by eliminating pain in their mouth and the need of ill-fitting dentures. So today we are going to cover how to get rid of paste and goose forever, how to stop having to put your teeth in a glass. I am going to share with you how age is not a factor in having a healthier mouth, how a new technology allows people who were told they could never have dental implants that now they are candidates, how you will gain confidence and a youthful smile with dental implants, how to choose the best doctor for your unique treatment. I am going to share with you the techniques that have changed people's lives, just like one of our patients, Press. When we saw her, she was a real estate agent who was afraid to smile with her teeth that she had and how she looked with her teeth. She was going to great lengths to just hide her mouth so people couldn't see her missing teeth. After working with us, she shared, and I quote, "Dr. Crawford, I got my smile back. You gave me my confidence back. And when you think about it, you gave me my life back." Can you imagine how important a smile is to a real estate agent and how having a new smile helped her not only with her job, but in her life in general? Now with Press, we use implants to replace all of her teeth. With Robin, we only placed one tooth, and she experienced a life-changing result as well. Ironically, Robin came to us as a second opinion because she just didn't feel comfortable with the first place that she went to. When she came into our office, she said, and I quote, "From the moment I walked in the door, that is the place I want to go. I always had anxiety going to the dentist my whole life because going to the dentist always hurt for me. But one thing that is different with Dr. Crawford was it was painless." These are just two stories of many you can see right on our website. I will give you more details about this later, but I want to share with these two stories with you because I want you to realize what I am explaining to you on this presentation works for people of all ages and needs, from one tooth to an entire mouth. Bottom line, by the end of this presentation, you will know exactly how to eliminate painful dental conditions. If you're like me, chances are you will have some questions throughout this presentation. Now, I want to be sure to get through all of this information I have prepared for you. So if you have questions, simply type them in as you have them, and I will do my best to answer them at the end of the presentation. I want you to turn off your cell phone, close your email, and shut down Facebook. Give me your focus and pay close attention to this presentation today because the information you are going to learn today can literally change your life. You absolutely don't want to miss anything. Clear all your distractions and focus for the next 30 minutes or so. I promise you will be grateful you did. So why is this presentation so important right now? If you are watching this presentation, chances are your teeth are deteriorating if you still have your teeth, or some of your teeth. You are frustrated with your life with dentures, if you have dentures, or you are simply living with pain in your mouth. Ultimately, I want to show you that you don't have to suffer anymore. You can get back to living a normal life again. Well, I want you to imagine if I could give you a magic wand and you would never have to worry about your teeth falling out in public again, or having to put your teeth in a glass, or even never having to use paste and gauze again. But first, let me ask you a question. How will your life be if you don't learn this important information? How will it be if you go to your next family event, like your grandchild's graduation or a wedding, and your teeth happen to fall out in the middle of the ceremony? How will it be if you continue to live with pain in your mouth? How will this affect you mentally, physically, and of course emotionally? The good news is I am going to show you exactly how easy it is to have a new mouth so you can enjoy food again, improve your confidence, and even have an overall healthier life. So at this point, you may be wondering, why am I even teaching this? And you might also be wondering that if this information is so good, why am I sharing it with you for free? Ultimately, I love helping people. I want to give you the information you need to determine if what I'm presenting to you at this presentation can help you. In fact, I'm not selling you anything on this webinar. Now, if you decide you want to have me help you with your own mouth, that would be great. But if not, I promise that what you're going to discover over the next half hour or so will absolutely be beneficial to you. Okay, so let's get started with a little bit about my background. So I have been around dentistry my entire life. My father was a dentist. I got to see firsthand how my father got to help people every day. I remember patients hugging him and thanking him for helping them with their smile and getting them out of pain. After going through 4 years of dental school at Washington University of St. Louis School of Dental Medicine, I went on to periodontal training at Boston University. It was around 1990, and dental implants were just starting to come on their own. I was really interested in being able to not only help people save their teeth, but even in situations where someone has no teeth and has lost all hope with having a healthy mouth again. Being able to use dental implants changed that. That's why I decided to become a periodontist. Even after 25 years, it never gets old changing people's lives and giving people hope. There is no better feeling in the world than when someone comes up to me and says, "Dr. Crawford, you have really changed my life. I just love that, and I enjoy helping people every day regain hope and confidence and improving their lives." Now, I have a limited amount of time with you on this presentation, and I'm going to give you all I can during our time together. My number one goal here is to give you information you need to determine if what I'm talking about on this presentation makes sense to you. I will also show you how dental implants can change your life. At the end of this, if you want to meet with me personally, I will show how you can schedule a consultation. So let's get started. Like in everything, technology has changed our lives, and it has changed the way in which we are able to do things. In medicine, they have robotics to assist in surgery. In dental implant care, we use a CT scan, which assists us in doing guided surgery, almost like having a robot. A CT scan is essential in diagnosing the amount of bone you have. The amount of bone you have will determine how dental implants can replace your missing or damaged teeth. When looking for a doctor, you want to make sure they have a CT scan because the CT scan gives us a 360-degree and three-dimensional view of your bone. Again, this is essential to make the proper diagnosis and customize your treatment. I can tell you that in the Tampa Bay area, most doctors do not have a CT scan. They are simply using two-dimensional x-rays, which give you limited information and oftentimes may show you that you do not have adequate bone, when in fact you do. If you have been told before that you can't have dental implants, chances are you really can. Personally, in our practice, I believe in always utilizing the most innovative technology. In our practice, we do have a CT scan with a 3D and 360-degree views. By utilizing this technology, this helps us with the first steps toward being able to help you have dental implants. Out of 25 years of doing implants and helping thousands of patients, there have only been 2 cases where they didn't have enough bone for implants. So once we have the 3D X-ray, we can determine the number and type of implants that you desire. During your consultation, we will show you the different treatment options, and together we will determine what your best solution or treatment is. For example, one option is the teeth in a day option, which is permanent or fixed, and another is the snap-in teeth. This option also provides a great deal of stability and security. With the snap-in option, you would come in for the placement of your implants. Then there are a few follow-up visits to ensure everything is healing well. Usually within 3 months, your snap-in teeth are made and will be able to be worn. With the teeth in a day option, you will come in, you will have your implants and your teeth placed in the same day. With either option, you are never without teeth. Oftentimes, people ask, does either procedure hurt? My response is, this is a surgical procedure, But in the 25 years I have been performing this surgery, most of our patients do not report any serious pain. They sometimes mention some discomfort or swelling. Each patient is given pain relievers to minimize the pain or discomfort they would have. During the procedure, you are completely numb and you will not feel anything. If you choose, we also offer oral sedation and nitrous oxide to help allow you to have a light sleep and to relax you. Additionally, at our practice, to make the procedure as comfortable as possible, we provide you with a comfort menu. From a massaging chair to a warm blanket to noise-canceling headphones to eye masks to anything that we can to provide to make your procedure as comfortable as possible. Another common question I get asked is, how long will it take? Well, in terms of surgical time, it could take as little as 1 hour or in extremely complex cases, 3 hours. In terms of healing, both procedures take approximately 3 months to completely heal, during which this time you will never go without teeth. Another question I am commonly asked is, are these procedures expensive? A lot of people think that you need an implant for every tooth. So they think they need 12 to 14 implants in each jaw just to get a set of teeth. And yes, that would be expensive. However, with all the options we have available in our practice, typically you only need 4 to 6 implants to replace the top or bottom set of teeth. This makes the procedure much more affordable for you. Additionally, we work with dental and medical insurances to help assist you in deferring some of the investment. We accept all major credit cards. We also offer 0% financing options and even low money down payment options. Ultimately, we do our best to create a plan that fits your budget. So at this point, you are probably wondering, who can help you with this procedure? So if we related this to a typical medical situation, your general physician may discover your heart condition, but usually they would refer you to a heart specialist to treat you. It's the same with procedures like teeth in a day or snap-in teeth. A general dentist may diagnose your problem and refer you to a periodontist like myself. A periodontist performs surgery to save your teeth, and also when there are no teeth, a periodontist can help place implants to replace your teeth. As with any surgery, you always want to choose a doctor who has extensive experience and training in that specific procedure. Again, you don't go to your general physician for heart surgery. Ultimately, you need to feel comfortable not only with the type of treatment you choose, but also with the periodontist who is performing your surgery. Of course, I could tell you how great the procedures are, but I would rather you hear from some actual patients. For example, Lisette said, and I quote, "You can trust his expertise, his gentle chairside manner, and his ability to treat you as family. This is what sets him apart from the rest." Or Tim, who said, and I quote, "With all the apprehension I have on traditional basis, when I step into Dr. Crawford's office, the comfort level is so great, and I can tell you that I have walked in there not sure about what I would be experiencing, but I have a great deal of trust that it won't be painful, which has helped me go through extensive implant process, which allows me to chew and smile and have more confidence. Ultimately, myself and our entire team strive to make you feel as comfortable as possible from the moment you walk in the door." So you are probably wondering, Dr. Bruce, I love what you're talking about, but will the teeth in a day or snap-in teeth work specifically for me? Well, you really have two choices. First, you could do nothing and continue to live with pain, but there is really no reason to live like this anymore. We are no longer in 1950 with limited technology. You could talk with me, someone who specializes in transforming smiles and performing these minimally invasive implant procedures all of the time. I am located right here in the Tampa Bay area. In fact, we have patients who live all over the country who come to us and see us for this procedure. I invite you to meet with me personally. I would love the chance to talk with you more about your specific mouth and treatment options, so together we can customize a plan for your unique needs and desires. Now, This is not for you if you are not open-minded to new technologies to help you live pain-free. This is also not for you if you are not willing to invest in improving your health. This is for you if you are open-minded to a new type of treatment that can help you have teeth again without ever needing paste or gauze. This is for you if you want to feel more confident and have a healthier smile. Ultimately, this is for you if you want to live a life with a pain-free mouth. You are probably saying to yourself, Dr. Crawford, this all sounds wonderful, but how much is it for a consultation? Well, that is a great question, and I usually charge new patients for consultations. But remember, I said earlier that I was not selling you anything on this presentation. Well, because you are on this presentation, I am offering you a free consultation. I want you to meet our team, see our office, and I certainly want to talk with you personally, so together we can determine what makes the most sense for you. So simply head over to www.consultwithdrcrawford.com to schedule your consultation. Let me tell you about a few more patients and their experience. This is Larry. Larry's lower denture was very loose, and now that he has implants, he can eat anything. Larry said, and I quote, "I would recommend it to anybody." Maria, she had pain in her jaw from childhood. She had trouble eating even soft foods. She said, and I quote, "My friend told me I look 10 years younger with my new teeth. From the age of 16, I was not approved to eat regular food. Now I can eat anything, and I feel great." Another patient said, "I went through implants with absolutely no problems whatsoever. I find my new implants are blended right in with my natural teeth. I feel great." Dr. Crawford did an excellent job. Him and his assistant should be commended for their great work. I thank him and the staff very much. I also helped the Browns with their dental treatment, and they said, "I love coming to Dr. Crawford's office because a lot of people are nervous about the dentist. And when I come in here, their hands are like angels. They are very gentle. I recommend Dr. Crawford to anyone. He is a great doctor." And last but not least, I'd like to go back to Tim, because Tim talks about what is even more important than myself and my team being friendly and our great chairside manner. As you have heard from our patients, we do provide comfortable care. But even more important, Tim shares, and I quote, "I did dental implants for my own personal comfort, having a good solid mouth, and it did restore my confidence as well. I can talk without a speech impediment. So ultimately, the teeth in a day or snap-in procedure is giving you more confidence, helping you feel more comfortable, allowing you to eat all the foods you want, and even improving your overall health." In fact, the Mayo Clinic performed a study that shows people who have their teeth live longer, healthier lives compared to those who struggle with dentures. So why am I doing this? Remember, I shared with you my passion for helping people. My team and I want to hold your hand throughout this process. I want to personally meet with you to understand your needs and desires. I want to answer your questions. Ultimately, I want you to stop suffering and feel better now. I simply want to help you. You deserve to at least find out more about this procedure. Imagine never having to worry about your teeth falling out again. Picture not having to deal with pain with your teeth or in your mouth. Imagine never having to worry about needing to use paste or gauze ever again. There is no obligation. You really have nothing to lose. I invite you to schedule your appointment. Come into our office right here in St. Petersburg, meet my team, and meet with me. But I only have a few appointments available, so I urge you to schedule today. So at this point, I would like to open it up to questions. Let's see. Here we have a question from Joe. Joe wants to know, how secure is the snap-in teeth? I understand the fixed solution is permanent, and that must be strong. But what about the snap-in option? Well, Joe, that is a great question. The snap-in option is extremely secure. It can only come out when you pull it out. When you come in for your consultation, you will be able to see how secure it is on one of our models. Suzanne wants to know, How is the roof of your mouth with either of these procedures? Well, Suzanne, you will be amazed that with either of these procedures, you will have the roof of your mouth back again. It will be open, not covered anymore. There is no acrylic or plastic on top like with your denture. You will be able to taste food again, and you will probably end up using less salt, if at all. Another question we have is from Ralph. Ralph says, my dentist told me I don't have enough bone for implants. You were saying in this presentation that that probably is not the case. Should I still come in and see you? Absolutely, Ralph. With our state-of-the-art CT scan, we can accurately determine how much bone you have. In many cases, we are also able to grow new bone through grafting procedures we routinely perform. This is why out of thousands of patients I have seen over the 25 years of practicing, only 2 did not have enough bone. So Ralph, I urge you to head over to www.consultwithdrcrawford.com to schedule your appointment. I will look forward to talking with you. Let's see here. Julie wants to know, how long will these implants last? Well, Julie, with proper care, your implants can last a lifetime. So Joe has another question here. Joe wants to know, will my insurance cover this? So currently, Medicaid and Medicare do not cover these type of procedures. However, many dental and some medical insurances help to defray the cost of implant treatment. We also have interest-free financing and flexible payment option plans. We accept all major credit cards. And again, we will do our best to fit this in your budget. Another question here is, what does the implant look like? Well, an implant simply looks like the root of your tooth. We call them root-formed implants. When you come in for your consultation, I will show you exactly what an implant looks like. Nancy wants to know, are there any health issues that would prevent me from being able to have implants? I have diabetes. Can I have implants? Nancy, I have helped many people with implants who have diabetes, high blood pressure, osteoporosis, etc. There are extremely limited conditions that would prevent you from having implant surgery, such as you have had radiation to your jaw, or if you have had a serious immune deficiency situation, in which case you would not want to perform any surgery. Nancy, and to everyone on this presentation, we will work closely with your medical provider to ensure your safety and health. Jane says, Dr. Crawford, great presentation. Thank you, Jane. This has been very informative. I am curious. The 2 procedures you talked about seem so simple. Is it really that simple of a process? Well, Jane, when you come to your consultation, I can go over with you as many details as you want for your specific procedure. But the reality is, with the technology you have in our office, these procedures are relatively simple. I feel it is best not to get into the technical aspects in this presentation. Again, I can go over more details with you in person. Thank you for your nice comments and question. Joe here says, thanks again for this presentation and answering all my questions. I do have one more. Do I need a referral from a dentist to come and see you? You are welcome, Joe. No referral is required from a dentist. Many of our patients are referred to us from a friend or family member who we have previously helped. I'd also like to mention, if you have seen someone already and you would like a second opinion, I am happy to give you a second opinion as well. Let's see, it looks like we have time for one more question. Bernard wants to know, is there any age where you don't perform this procedure? Bernard, age is not an important factor in determining whether you are a candidate. We have patients in their late 80s and even 90s who we have done implants on. So, if I did not answer your question, one of my team members will follow up with you. Additionally, you can call our office at 727-308-5404. If you haven't already, head over to www.consultwithdrcrawford.com to schedule your consultation. Again, there is no obligation, and this consultation is 100% free. I look forward to talking with you and seeing how we can help you. Thanks again for your time today.